When we founded our organization in 2009, as a part of our process of submitting our applications, the gentleman was very fond of us in terms of our plight, in terms of seeking out to be a provider in the state of Maryland. And one of the questions that he asked us was, have you heard of CBH?
While the world around us is ever changing and the CBH keeps us anchored to the world of mental health outside of our doors, that is totally going to impact what we're doing every day, and it will absolutely impact our future.
CBH has been really great at sort of helping to build that community and helping us as a small provider feeling like, hey, I have a question kind of thing.
CBH has been integral in our success, particularly in the past couple of years. PDG, along with all of the agencies in Maryland, were legitimately hit with a double whammy of pandemic, of changing in Maryland's ASO. And without CBH's support in the course of those two huge, potentially deadly stressors for our organization, we would not have been able to make it.
On all ends, CBH has helped me and my job and my organization. They know what the key issues are for behavioral health providers. We know that, staffing is a problem, getting paid on time.
Lack of pay has really been affecting our ability to hire clinicians. And if we can't hire clinicians, then we can't stay open, and then people who need help can't get the help that they need. You're fighters, you're pit bulls, you go in there, you're willing to do the hard work and advocate for us.
It was because of CBH and all the great people that work there that really helped us fine-tune what was going on, and it was like whack-a-mole. There were so many different areas that needed help, and they just were really helpful in getting us organized to be like, okay, this is the bigger issue, and this is what we're gonna attack.
I think what excites me the most is the fact that we have seen so much stigma reduced with mental health and mental illness, especially with something as tragic as COVID. But the fact that, with that stigma reduction, we're seeing more resources being put out for behavioral health services. We're seeing more people talking about it, especially our young people. I think that's what really excites me the most.
There wasn't a really strong voice for children and youth in the behavioral health world. And CBH has intentionally now kind of stepped forward to be a voice specifically for the benefit of youth who are experiencing behavioral health issues.
I think for any organization that's considering joining the Community Behavioral Health Association, the most important thing they can think about is being in the know of what is happening in the evolution of behavioral health in the state of Maryland. I think it's critically important that they participate in the advocacy to the state on how the public behavioral health system should be actioned and to help our citizens in Maryland.
Putting everything else aside, it's fun. It's a lot of fun. CBH puts on great events every single year that I know I personally have benefited from as the leader of a nonprofit organization to support my own growth and development, and also the opportunity to connect with other providers, to network, and to really work together with other providers that I would have never met on my own.
The education, the knowledge, the advocacy, the resources, they're just really so integral to anyone who's in the public behavioral health system and providing services. I get some of my best information and next steps and ideas from being a member of CBH.
Our association is part of how we all come to the table and make sure that we are giving the same message. And the same message is going to be, we have people who need help. And honestly, we know how to help these people. Please allow us to do so. Please give us the tools to do so.
This is vital to improving our workforce conditions, improving our rates, and helping these organizations stay viable in the future.
Our ability to have that integrated message, that singular message that we're able to bring to all the people who make the decisions is a critical part, and part of why having a robust membership with CBH is critical to the health of behavioral health in Maryland.
CBH is an organization that I would recommend anyone in the behavioral health arena to become a member of. Become a member today.
It's an opportunity to be involved in changes that are coming down the pike, and not being on the back end, but being on the front end and actually boots on the ground.
One voice cannot do this alone. And so as a connected, collaborative network, that's how we get our voices heard.
You just have to have it. It's our insurance that our business is going to continue to have support, knowledge, and all of these great opportunities that they have to continue to elevate the work that we do.